Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So as you know, we were discussing about breastfeeding and how we can make it enable to the working mother. So we were discussing about the problems related to working mother in relation to feeding the baby. Okay, so what are the different problems which is faced by the working mother with regard to feeding of the baby? Okay, so now the big question is maternity leave is over and what we have to do next. So this is applied to the private sector and also government sector. So after 6 months, now she has to resume to the work, and baby is 6 months old. Baby is on exclusive breastfeeding, and now gradually she has to shift to the working mode, and also the baby should also get shift to the top feed mode because round the clock mother is not available. Now in this time, if the mother is not properly guided, then mother may commit some of the mistakes. Number one is she may shift completely to the top feed along with only night breastfeed. In the night hours she is giving some of the breast milk, that is feeding the baby with the breast milk, but in the whole daytime she is only going for top feed. This is one of the mistakes that she can do. Another one is she may completely stop and completely shift to top feed. And third one is she is in confusion, she is under confusion, and she may feel guilty consciousness. Oh, I have to feed my baby but I'm not able to do, my baby will going to badly suffer, and all this thing, guilty conscious she will have. And sometimes it may result in overfeeding. Suppose mother is not there, she is in the working place, and somebody in the home may overfeed the baby with the top feed, or maybe underfeeding. They may not able to identify whether the baby is completely satisfied or not. Underfeeding and overfeeding, these problems may be there. Okay, so these are some of the basic problems, and mother may commit these mistakes. So if she is properly guided, so you can avoid all these mistakes, and it is also very much helpful to the baby. Now one thing we have to be very clear in mind, that baby, if the mother is working somewhere and she is not able to give all the 24 hours to the baby is not only missing the nutrition, but baby is also missing the attachment and emotional support. Okay, that's the big issue. Actually after 6 months you can manage the baby with some other top feed, etc., but there is no replacement for this emotional attachment and as well as maternal bonding. Okay, so that's the big issue. So now breast milk is, suppose if you're giving the breast milk, it is not only nutrition but also it is an emotional link. Okay, it's a maternal bondage link it is. So that cannot be replaced. So if you want to have a continuous emotional link with the mother, then even a working mother should give the breast milk to the baby. Now you can ask how it is possible. Okay, so again, don't forget, after 6 months nutritional dependence decreases, but the emotional dependency increases. Why I'm stressing on this factor is, after 6 months, actually up to 6 months baby is receiving all the nutrition from the mother in the form of the breast milk, and after 6 months the caloric requirement is more, baby has to take something from the outside, otherwise also we will start the complementary feed. So somehow the nutritional dependence on the mother is going to decrease. Okay, but emotional and attachment dependence is now more, therefore it leads to separation anxiety. Mother is going to the work and baby is crying, and after going to the work mother is also crying there. So this type of emotional problems do occur. So we need to manage this also, this emotional separation anxiety, etc. So when the mother is going to the work, if the baby is crying, it was very painful to the mother. Okay, so she cannot tolerate it. So we often see this problem with the working mother. Okay, so we have to understand that breast milk is also emotional link. It's an emotional link, not only the nutrition. Now the question is how to handle all these problems. So best solution is expressive breast milk. Yes, we will call it as EBM, expressed breast milk. This, once the period of exclusive breastfeeding is over, up to 6 months, we will call it as period of exclusive breastfeeding. Now along with the top feed you have to also start the EBM. Now what do you mean by EBM? EBM means expressed breast milk. Breast milk is there and that will be expressed by the mother or squeezed and collected in a clean container by the mother, and that particular EBM will be given to the baby in the absence of the mother. So what is this? Express the breast milk. So what are the methods to express the breast milk? Now usually first, if possible, go for mild fomentation over the breast area, and followed by the mild massage. Okay, mild massage. So massaging should be done on the breast area, up and down and sideways, etc., or circular fashion, etc., and then hold, compress, and as well as release. These are the three steps. First you have to hold the breast, just lift the breast, then compress the breast, and then release the breast. Then the breast milk ejection will takes place. So this is, if I will show the figures later, and if you want to express the breast milk from your breast manually, this is the method. First go for mild massage, then go for some fomentation, and afterwards just give some of the circular movements and upward downward movements and also the lateral movements, and then just lift and hold the breast, hold the hand fingers just beneath the areola portion and compress. Okay, when you compress and then release, then the ejection of the breast milk will takes place. So this is if you want to do it manually. You have got the breast pump also. So breast pump can be used for the expression of the breast milk. Even we have got electrical breast pumps. Electrical breast milk compression pumps are also there. So another easiest method is, suppose when you are feeding your baby, suppose you are in the home environment now, not in the work environment, you are feeding the baby, and we know that when you are feeding one breast, naturally the milk also oozes out from the second breast, another breast. Okay, so by that time you can collect this milk which is oozing out, getting wasted, and that can be used as EBM and can be given to the baby. So collect it and store it and feed the baby whenever needed when you are at workplace. In your absence in the home, somebody can give this EBM. Now thing is, breast milk, it is only your breast milk, isn't it? So that's a link. Okay, that breast milk is a link between you and your baby, emotional link it is there. Instead of giving the top feed, this is a link. Of course, after 6 months we have to start the top feeding also, because caloric requirement is also more. But along with the top feed, as far as possible, you have to continue the EBM. Suppose in your absence, baby is taking feed for 6 times. Okay, from 9 o'clock to 5 o'clock, 6 times. Then you substitute, that means 3 times, 3 feeds can be given with the top feed and 3 feeds can be given with the EBM. Okay, so this is the best way out. So next part of this breast milk challenges for a working mother, we will continue in the next class.